Now, for more on health innovation, I'm joined by Kate Tulenko. She's Vice President of Health Systems Innovation at IntraHealth International. Welcome to the show.
Thank you.
Now, Kate, when you look at everything that's out there, in your view, what are some of the key developments that you think are really going to shape the future of health innovation?
In the last few years, platforms for innovation have come about. This includes the sharing of data, including large amounts of patient data to be used, or platforms that allow rapid sequencing of DNA or rapid creation of new types of proteins. And so it's that type of platform that's going to encourage innovation.
Now, we also hear a lot of things about augmented reality, health sensors, other things like that. How are these other tech fields playing into that as well?
Well, when you think of it, most health innovations actually come from other fields, like maybe it's material science that comes up with a new material that prevents blood from clotting, or IT comes up with a new way of communicating to health workers. So all fields actually do contribute to health innovation.
So seeing a lot more collaboration.
Mm-hmm. Yes.
Now, when it comes to, there are diseases like cancer that obviously people have been trying to fight for a very long time. And at the same time, you also have outbreaks like Ebola and the Zika virus that, not come out of nowhere, but basically come on suddenly. But in terms of the most pressing health issues right now, what would you say is really at the forefront?
It sort of depends on who your audience is. If your audience is the higher income countries, it's probably things like cardiac disease, cancer. If it's the lower middle income diseases, it's issues of access and how do you innovate around access. An example of that is there's a group of clinics in Mexico that have gotten the price of taking care of a diabetic down from $10,000 a year to $2,000 a year.
And when you look at the way that people are able to do this, is it mostly private, is it government, or is it a combination of the two?
It is a combination. Governments have a role in incentivizing innovation and creating educational systems that train people to innovate, but ultimately the majority of research and development money comes from the private sector.
Now, what about in the case of getting these things from production into the hands of patients? What are some of the challenges in that?
Right. Well, there's the whole innovation cycle. So, the creation of the innovation is the first step. Then it has to be approved through a regulation process. It has to be patented. And then there's the scale up. And, the scale up first usually starts with high income people or people who have health insurance. And then as it gets cheaper, it can then expand out to other people.
Now, in some cases, when people have developed these things, they've hiked up the prices. Mm-hmm. So in terms of making it more accessible for people, what would you like to see happen?
Mm-hmm. Well, often the World Health Organization and other global bodies can negotiate that. There's a great example of a hepatitis C drug, which came out recently and was priced around $100,000. This was done purposely because this was just below the lifetime cost of taking care of someone with hepatitis C. But WHO has been able to negotiate that now it's going to be available in many low-income countries for about $300.
So some company strategy in there. Now, what about some of the pros and cons? Just because we have access to this medical data, to this technology, doesn't necessarily mean we know how to use it. When it comes to how patients are using this, now that they have all this information out there, are there any concerns?
Yeah, people call this Google medicine. And, physicians are often frustrated when someone comes in with reams of paper and thinks they have this disease and that disease. On the pros, people become more engaged in their health and start to research their conditions and really be more responsible. On the cons, they might try things that, are unsafe or might try to practice medicine on themselves. But in general, physicians and nurses need to learn how to work more with patients and really be collaborators in health.
And you mentioned some of the workers. What about the people, the medical staff, the people who need the training? Do we actually have enough people on the ground to be able to help us to use all this technology, or are those going to be the jobs of the future?
Oh my goodness, that's a huge challenge. There's a shortage of about 18 million health workers right now, and that's only going to grow with global aging and with global population growth.
And just lastly, when you come to look at who's making the biggest strides, are there any countries or companies that are really at the forefront?
Well, the World Intellectual Property Organization tracks this, and Japan actually has the most patents per year, followed by the US and China. But when you look at number of patents per population or patents per GDP, it's South Korea. They've had a very strong policy of coordinating between the private sector and government think tanks.
All right, so lots of good examples to follow. Thank you so much for joining us, Kate Tulenko from IntraHealth International.